we're starting to find is that immune responses to vaccines in transplant patients, in particular to SARS-CoV-2 vaccination, has been suboptimal, to say the least. For example, if we're talking about the mRNA vaccines, after one dose of the mRNA vaccine in immunocompetent people, 100% will demonstrate an antibody response. After one dose of the mRNA vaccine in transplant patients, only 20% demonstrate any antibody response. And in general, the antibody response is lower than that of immunocompetent people. And what that means is that there is probably some advantage, there's some protection that transplant patients are seeing. There's some immune response, there's some antibodies, probably some T cell response, but the overall level of protection in transplant patients who've been vaccinated is much lower than the level of protection in the general population. And so transplant patients still have to be very careful. When the pandemic first hit, the reports from Italy, from New York, from the early areas that were seeing this pandemic showed about 30% mortality in transplant patients who were infected with SARS-CoV-2 and developed COVID-19. I think within 6 months of the initial pandemic, many lessons were learned: better ICU management, better use of steroids and other adjuvant agents to reduce the immunoinflammatory response, better ventilator management, etc. Our recent mortality in our center for transplant patients with COVID-19 is only 4%. More recently, more lessons have been learned in terms of immediate post-exposure treatment. So, for example, there are monoclonal antibodies that are available. There was convalescent plasma available, et cetera. So I think the combination of these post-exposure early treatments as well as better hospital and ICU management has really made this a much less impactful disease on transplant patients than it was at the beginning of the pandemic.